Hi everyone, Dr. Amy from Posturesize. Today we've got a great personal training tip of how to train your clients with hip and knee arthritis using the lengthened split squat. Hope you enjoy. So when it comes to personally training our clients with hip and knee arthritis, we're many times at a loss in terms of what to do with lower body training with compound exercises, because typical compound exercises like squats, lunges, leg presses put too much flexion or bend into the hip joint and the knee joint. And the more those joints bend, the more they compress the cartilage or what's left of the cartilage in the joint, irritates the synovial lining in the joint. Many times the capsule becomes painful. We wind up losing that client. Many times we think we're limited to isolation exercises like hip, ad, and abduction with cables and bands, or leg extensions like curls, but there's a great compound exercise that you can do with your personal training clients with hip and knee arthritis that not only provides a great training stimulus for those muscles and a good workout, but it targets many of the weak stabilizing muscles that are oftentimes adding to the mechanical stress to their hip and knee arthritic joints. So what I suggest and what I train my personal trainers that I teach in is what's called lengthened split squat. Normal split squat stance, we start off with a width of our feet that allows the center of our knee and ankle to be directly underneath the center of our thigh, meaning from knee to groin and inner to outer thigh. That would be too narrow for me, that would be too wide for me. From this stance or width, we're going to lengthen our split stance. And normally in a split stance squat, what we're going to be doing is we have a long depth where we can bring that knee all the way down. That still has a lot of bend on the knee and the hip joint. However, when we lengthen it, when we bring it out as much as we can, and you can have your client hold on to something for balance if you need, now all of a sudden our center of gravity is lower and there's a lot less bend to both the hip and the knee, and many times this is a comfortable range of motion that can work in. Now, because we're using a decreased overall range of motion, we still want to provide a good training stimulus to the associated muscles of the hip and the leg. So to do this, we're going to slow our cadence down with these lengthened split squats. As opposed to a normal 1 or 2 second eccentric and concentric contraction, we're going to be taking perhaps 5 seconds to come down or greater and 5 seconds to come up. You notice my range of motion isn't as great, I'll show you from the side, but there's a lot more stress on the muscle. And if you notice, in this lengthened stance, my knee is not bending as much and my hip is not bending as much. That decreases the overall stress on that hip and knee arthritis that personal training client is suffering from. The key mistakes to watch out for with this, because most of your clients will do this, is the front leg. You may need to hold on to something for some balance. The front leg has a tendency to hip pike or raise up on one side. That's due to a weakness in the glute medius on that front leg side. That takes mechanical pressure and increases it in the hip because you have compensatory changes in the hip flexors. So keeping that front hip level or swinging it down so it's level with the back hip will help to decrease it and help to increase the load of the stress on the glute medius, which is essential for most of your clients with hip arthritis. The back leg has a tendency to externally rotate, the toe pointing out. This creates an external rotation on that hip that many times is associated with problems with hip arthritis as well as rotational stress into the knee joint. So make sure that that back foot is loaded in a straight position as you increase the stress on it by going down. The front knee with the lengthened split stance will have less of a tendency to translate forward, which decreases mechanical stress both on the main knee joint and underneath the patella or kneecap. And the front leg, make sure that the knee and the toe are pointing the same direction so you don't have a rotational stress. Plug these split squats into your personal training routine. For clients with hip and knee arthritis, you'll find that using a 5-second, even 10 or 15-second cadence can be brutally great for increasing muscle strength, for increasing the pump, giving them a great workout without aggravating their joints. Like most arthritic cases, the key to success in personal training is avoiding excess compression with weight, excess compression with overall range of motion, but increasing the stress on the muscle, which a slow cadence and this split squat will do. The other benefit from this split squat is using a stance that I described as opposed to a wide stance is going to be a bit of a balance challenge for the client. Balance many times is off when we have hip and knee arthritis due to altered proprioception and kinesthetic sense. So training them to maintain good balance and good mechanics, watching out for those errors we just mentioned, helps to actually improve their overall balance, and that will help to decrease the stress overall on the hip and knee joints. If you like this video on training your personal training clients with hip and knee arthritis using this split squat, please feel free to subscribe to our channel. We get a lot of other great videos out there to help you with personally training your clients with injuries. If you'd like to help me share this valuable information with others, give me a thumbs up. Questions or comments, write in. I'll do my best to answer them. And again, remember, many of these techniques are shared in our essential crash course for personal trainers that targets the assessment, program design, and exercise modifications for your personal training clients with injuries. I hope this series on split squats for hip and knee arthritis helps you in your personal training.